Imagine millions of children in developing countries facing a hidden health threat: type 5 diabetes. This newly recognized disease affects young lives worldwide and is different from type 1 and type 2 diabetes. Type 5 diabetes happens when the body doesn't make enough insulin, often due to malnutrition in childhood. Unlike type 1, it's not an autoimmune disease but is linked to poor nutrition. The discovery of type 5 diabetes shows how vital good nutrition is for healthy childhood development. Understanding the difference between type 5 diabetes and other types is crucial for proper diagnosis and treatment. All types involve insulin problems, but their causes differ. Type 1 is an autoimmune disease destroying insulin-producing cells, requiring lifelong insulin. Type 2 is linked to obesity and insulin resistance, often managed with lifestyle changes and medication. Type 5 stands apart, driven by malnutrition, not insulin resistance. The pancreas can't produce enough insulin due to early life nutritional deficiencies. Accurate diagnosis is vital, as treatment approaches differ for each type. For decades, type 5 diabetes remained hidden in plain sight, often misdiagnosed as type 1 or type 2. This lack of understanding had significant consequences for individuals, especially children in developing nations. The early signs of type 5 diabetes, like frequent urination, excessive thirst, and unexplained weight loss, often overlap with other types of diabetes. This made it challenging to pinpoint the exact cause, especially in regions with limited healthcare resources. The historical context is important here. In many developing countries where malnutrition was, unfortunately, more common, cases of what we now know as type 5 diabetes were often misdiagnosed as type 1. This meant children were unnecessarily subjected to lifelong insulin injections, a costly and, in some cases, inaccessible treatment option. This misdiagnosis wasn't just a matter of inconvenience, it had real-life consequences. Imagine a family in a remote village struggling to afford insulin for their child, unaware that oral medication might be a viable option. The financial burden, coupled with limited access to healthcare, could be devastating. The story of type 5 diabetes is one of scientific discovery, global collaboration, and a growing commitment to equitable healthcare. Researchers like Dr. Meredith Hawkins played a pivotal role in bringing this condition to light. Dr. Hawkins and her team conducted groundbreaking research that revealed the distinct characteristics of type 5 diabetes. Their work demonstrated that this form of diabetes was not simply a variation of type 1 or type 2. It was a separate entity with its own unique causes and treatment approaches. This discovery was a game changer. It led to the official recognition of type 5 diabetes by the International Diabetes Federation in 2025, marking a historic shift in our understanding and approach to this global health challenge. The recognition of type 5 diabetes has paved the way for more targeted treatments and improved care, especially in low-resource settings. Since many individuals with type 5 diabetes can manage their condition with oral medication and lifestyle modifications, it offers a more accessible and affordable treatment option compared to insulin injections. The future of diabetes care, particularly for those with type 5, is filled with hope and optimism. The global recognition of this condition has spurred new research, improved diagnostic tools, and a greater focus on prevention and early intervention. The formation of dedicated working groups, like the Type 5 Diabetes Working Group co-chaired by Dr. Hawkins, is a testament to the commitment of the medical community to tackle this challenge head-on. These groups are developing clear diagnostic criteria, treatment guidelines, and educational resources for healthcare professionals worldwide. The emphasis on raising awareness is another crucial step. By educating communities, healthcare workers, and policymakers about type 5 diabetes, we can ensure timely diagnosis, appropriate treatment, and better support for those affected. The story of type 5 diabetes reminds us that medical knowledge is constantly evolving. What was once misunderstood or overlooked can emerge as a new frontier in healthcare. It highlights the importance of continued research, global collaboration, and a commitment to ensuring that everyone, regardless of their background or geographic location, has access to quality healthcare.